Hello everyone. This is going to be a Q&A video. I hadn't planned on doing this just yet. I've been in my garden painting my garden wall, but it's decided to rain. So I've come indoors and I thought I'll do the Q&A video now because I've had a couple of questions from you guys out there. So I'm going to try and answer that as best I can in this video. Now the first question I had was from Manzar Kasid. I hope I've pronounced that right, Manzar. And you were asking me about a drug called Xanax. And you thought that I had taken Xanax to help me. If I'm reading what you've put correctly, that I have taken Xanax. I have never taken Xanax. I've never been prescribed Xanax to help me sleep. I think it's more, from what I know, it's more of a drug that's prescribed in America. I know there is a girl in America with tinnitus who has her own YouTube channel, and I know that she has taken Xanax, but I have never taken it, so I cannot comment on Xanax. In regards to medication to help with sleep, the medication that I took and still sometimes take is a medication called nitrazepam. Now, nitrazepam, like most drugs, and I think this is what you're worried about, what your concern is in regards to taking a drug to help you sleep, is that it can become addictive. And it's true, most drugs, including nitrazepam, can become addictive. Xanax, I don't know, because I don't know enough about it and I've never taken it, but it probably, yes, you're right, it can become addictive, and you don't want to become addicted to it. Now, in your post to me, you've written that you managed to sleep for 4 hours, for 4 hours in the day, for 4 days, 4 hours for the last 4 days, you've written. Now, if you're taking this medication, whatever medication it may be, Xanax by the sound of it, if you're taking medication to send yourself to sleep during the daytime, this to me says that you're not in a good place with your tinnitus. If you are taking a medication to send you to sleep during the daytime, I'm sorry to say that it sounds like you're still in a pretty bad place with your tinnitus. As for not becoming addicted to medication, my advice to you would be certainly not to stop taking your medication suddenly and go cold turkey with it, because your body won't like that. If you've been taking this medication for a while to help you go to sleep, your body will not like suddenly being deprived of this medication, and it will probably affect your tinnitus, and your body and your mind will not like this. From my own experience with medication to help me sleep, when I was first struck with tinnitus and life was just awful, and I know why a lot of you guys out there are taking medication to just escape from the noise in your head. I fully understand. When I was at my worst with my tinnitus, I would have taken anything just to escape that noise, and I did. I took medication, high dosage of nitrazepam, and also I was taking amitriptyline at the time, which is an antidepressant, but that also has properties in it that will make you go to sleep. And I would take that during the day just to escape this noise in my head and just escape and go to sleep during the day. The way I came off of that and away from that is, and this is my advice to you, Manzar, if you don't want to become addicted to taking medication to help you sleep. And if you are taking it during the day to go to sleep, my advice is, when you are awake, what you need to do is find methods, treatments and ways of controlling, managing and getting your tinnitus while you are awake during the day to a level where, although it is still with you, you are comfortable. You can still have a normal, relatively normal day-to-day life. Once you get to that stage and you find ways and methods that you can have a normal day with your tinnitus, my tinnitus is still with me during the day. It is still with me. But I have found ways and methods to get it to a level where I can have a relatively normal day-to-day life. I found I can do that. Grey is another great example. You do not have to suffer during the day with your tinnitus. Once you find methods and ways that you can get to a comfortable level with your tinnitus during the day, once you're there, then my advice would be to slowly lower the dosage of whatever drug it is you're taking, whether that be Xanax, nitrazepam, amitriptyline, whatever drug it is that you are taking to get you to go to sleep. I would start to wean myself off of it. That's what I did, slowly lower the dosage. Now, having said that, like I say, from what you've written, you're going to sleep during the day, so you're still not in a very good place, so it's going to take a little while for you, but you will get there. Find ways and methods that help you to get to a comfortable place with your tinnitus during the day, then start to wean yourself off of the medication you're taking to help you sleep. Having said that, my tinnitus is most noticeable to me in the evening time. For other people it's the other way round, but for me, my tinnitus is most noticeable to me in the evening. When I go to bed, that's when I will still notice it, and it can be irritating. Usually I have found that by using the breathing technique that Andrew Parr taught me through his meditation videos, by using this breathing technique and the meditation technique, just by laying there and breathing in a certain way, my mind relates that to relaxation, and quite often I can just fall to sleep like that. If that doesn't work, I will listen to the actual audio files that I've been doing the videos of that Andrew Parr sent me. In particular, this is good timing actually, because in particular the last one I did, number 6, is very good for sending you to sleep. Why this is, I don't really know, but it is a good one for sending you to sleep. It is quite a deep one, and I can testify that it does send you to sleep, because I fell asleep 3 times trying to make that video, and if anybody watches that, you'll see I do fall asleep at the end of that video, which was not the intention, but I do fall asleep, so it's a good one for that. If I still cannot sleep after doing my breathing, my meditation, or listening to Andrew, I will then, if I really need to, and I did this when I was having that bad spike, I will take trimazepam to help me to go to sleep. If I've had a bad week with tinnitus and I feel like I need to, I will still take 1 to 2 trimazepam tablets, you know, maybe 1-2 days during the week to help me go to sleep. But I try to not do that if I can, and rely on the natural methods, because I don't want to become addicted to it, and you're right, they can become addictive. So yes, in short, my advice to you, Manzar, is if you are taking medication to sleep during the day, before you start to stop taking the medication to help you sleep during the day, when you are awake, you need to find ways and methods to get you to a place where you are comfortable with your tinnitus. Your tinnitus will be with you, but you will be in a place where you can be comfortable with it. And when you are in that place, you will no longer feel the need to take medication to go to sleep and escape during the day. So find methods that work for you during the day to get the tinnitus to a comfortable level, then start to wean yourself away from the medication you are taking, lowering the dosage each time until you get to a point where you don't need to go to sleep during the day. You can have a relatively normal day-to-day life, and then that will help you to sleep as you should be in the evening a lot easier. You may need to take medication in the evening to help you sleep, but that is still progress as opposed to you taking it during the day. So start off with that. So aim for being able to be in a comfortable place with your tinnitus during the day, and then lower the dosage, and then move on to, if you have to, take the medication during the evening, and then slowly wean yourself away from that. That's my advice on that, and I hope that answers and helps your question. Now, the other thing I want to talk about, it's not really a question, but I had a post from Scott. Yeah, Scott Sutherland, fellow biker. Hi, Scott. And he has sent a post to me where he had a session of Cranio Therapy, and he says that his therapist was unable to connect with his tinnitus, and his therapist, if I'm reading this correctly in the manner it's put across, that his therapist has said to him, I wouldn't bother with craniosacral therapy, it's not going to help you. You know, I wouldn't bother with it. It's not going to help you at all, because your tinnitus is to do with your muscle tension in your face and around your jaw, so I wouldn't bother with craniotherapy. Now, firstly, she may be right. There may well be a connection with muscle tension in your jaw and your tinnitus. She may well be right about that. However, she doesn't know. Frankly, she's guessing. But more importantly than that, a good, experienced craniosacral therapist, such as Rob Williamson, my therapist, and of course Julian Cohen-Hill, a good, experienced, skillful cranial therapist will be able to, or should be able to, help you alleviate and reduce any muscle tension in your jaw. I know this because I've had it done. Now, when I went to see Rob, my therapist, recently, he had said to me, I can feel a lot of tension in the right side of your face, the jaw area. I wasn't really aware of it, but he said he could feel it, and he performed craniotherapy with his hands, with his fingers, actually inside my mouth, both sides, but particularly the right hand side. And he was pushing on pressure points, the muscles within this side of my face, inside my mouth. And once he had finished, then I knew that I had tension, and that my right side of my jaw had been very taut, because it felt so much looser and so much more relaxed. So he was right, but it was only after he performed this that I felt the difference. So the point I'm trying to make is, for your therapist to say to you, your craniotherapist to say to you, craniotherapy isn't going to do you any good because your tinnitus is caused by tension in your muscles in your face. Yes, it's true, there may be a connection between muscle tension and your tinnitus, okay, but an experienced, skilled, good craniotherapist who knows what they're doing should be able to help you with this muscle tension. they should be able to release this muscle tension, because the bottom line is, it is not the muscles in your face that are causing you to hear this noise. Your muscles are not creating this phantom sound that you are hearing in your head. It is still your brain, your mind, that is creating the noise, this phantom noise you hear. It's not the muscles in your face, it's your brain. The muscles in your face may be a trigger and contribute to your nervous system hearing this noise, and for your craniotherapist to say it's nothing to do, if I've read this correctly, it's nothing to do with your nervous system, quite frankly, I think she's wrong. I don't think your tinnitus is solely because of muscles in the side of your face. I think all tinnitus, whether it's caused by loud noise exposure or high levels of stress, etc., I think all tinnitus is connected with your nervous system. However you got it, whatever symptoms people tell you, I think all tinnitus is connected to your nervous system, and in being connected to your nervous system, it is also attached to your emotional state. But going back to the muscle issue, a good craniotherapist should be able to alleviate that for you and help you with muscle tension. Now, you do say that the problem that you've got is you're limited with the treatment options because you live on an island off the coast of Scotland. Yeah, if you're living on an island off the coast of Scotland, I'm presuming it's not a very big island, and yeah, you're going to be pretty limited to the therapist that you will have available to you, unfortunately. If you can find another craniotherapist, I would give it another go, because, and I haven't said anything about this before because I didn't want to put people off the idea, but before I had my craniotherapy with Julian Cohen-Hill, and before I had my therapy with Rob Williamson, before those two fantastic therapists, I had heard Julian talk about craniotherapy, and I went to a different local therapist. The first time I ever had this therapy done, I went to a different therapist, and I haven't spoken about this before because I didn't want to put people off. And I had craniotherapy by someone that claimed to be a craniotherapist, and I got nothing from it because they did not really know what they were doing. I didn't know this at the time because I hadn't seen anybody else. But after seeing this person, which did nothing for me, although they were feeling around my face, but it's more like a massage. After seeing this person and getting nothing from it, then going and having craniotherapy by Julian Cohen-Hill, the difference was just, it's it couldn't compare. Julian obviously knows exactly what he's doing. The sensations that I got were just lovely. And after seeing Julian, I then found Rob Williamson, my local therapist, and again, his manner and the way he comes across reminds me a lot of Julian Cohen-Hill. If you listen to Julian Cohen-Hill just speaking, it's relaxing. Just hearing this man speak, I find very relaxing. And my own therapist, I have the same vibe with. Now, with I'm thinking about it now, it's so lovely. I look forward to it so much. I had a session yesterday, and it's just lovely, and it's more intense and enjoyable each time. And this is another point, Scott. A good craniosacral therapist, the more sessions you have with them, they will be learning along with yourself what works for you. The first session I had with Rob Williamson, I did have these lovely feelings of what I describe as true relaxation and a sensation of bubbles and lightness going through my legs. And then the next session I had it through my legs, and then I felt it in my hands. And now, when I see him now, I try and have 1 to 2 sessions each month at least. Now when I see Rob, I have this lovely sensation of relaxation and bubbles and lightness run right the way through my entire body, from my head right the way through to my feet, and it's just lovely. But this is because Rob has learned what points of my nervous system and pressure points to focus the therapy on. The way he uses his fingertips on my nervous system, points of my body, is different to how he applies the craniotherapy to another patient, for want of a better word, another tinnitus person. It will be different because although our nervous system, one of the main points is the brainstem, the spine, we are all different in certain ways, and they will learn along with you. The more sessions you have, what works best for you. So for your craniotherapist, if I've got this right, and you've only had one session with them, to turn around after just one session and say, well, that didn't work, so I wouldn't bother with it anymore, I don't think that's very good. I'm not very impressed with that. Maybe ask her to try again, try different methods, I don't know, but better than that, I think, would be try to find another craniotherapist, and maybe you'll have better luck with them. But as you say, if you're on an island off of Scotland, yeah, you're right, you've got limited resources there, haven't you? So my point about this is, I wouldn't disregard craniotherapy. If you have the chance of having it with someone else, I would try it again, because a good craniotherapist will be able to help you with this tension, this muscle tension within your jaw. They will be able to help you with that, and in doing that, that should help with your tinnitus. So yeah, that is my advice. Also, I see that you have changed you said that your job was causing you a lot of stress, and stress and pressure, and that was getting to you, and I know exactly how you feel about that. But you've changed your job, which is, you've made a step in the right direction. You've put some action there, and you've changed your job, and your new job is going to be far less stressful, which will be brilliant. I mean, that will definitely, without doubt, that will definitely help you in calming down of your nervous system, because stress is just the worst thing. Tinnitus feeds from stress and anger and emotions like that. It feeds on it. So if your new job, and by the sound of it, it's you're very, very happy with it, less stress will definitely have a positive effect on calming your nervous system, and in calming your nervous system should help reduce your tinnitus. Right, I think that's it for this Q&A video. For those that have asked, I will be making the meditation video, the next one, number 7, next week, and I'll try not to fall asleep in this one, hopefully. Again, thank you all to all of you who have subscribed to my channel, and I hope to speak to you again soon. Thank you all very much. Bye bye.